Thank you, Mr. President. Mr. President, there is a disturbing pattern that is emerging in Washington, D.C., which I don't think is being lost on the American people. We've seen since the beginning of this year, with the new administration coming to power, the new Congress taking control of the leadership in both the House and the Senate, an enormous amount, unprecedented amounts of spending, borrowing, and taxing. And I think that to bear that out, and this, I guess, piece of information has been used before, but if you actually look at the numbers, you have to go back a long ways in American history. You go back to the foundation of our country, you go back to 1789, and you take it up through today, 2009, 220 years of American history. The total amount of debt that has been accumulated over that period of time, literally since the presidency of George Washington through the presidency of George Bush, will be equaled in the next 5 years. We will double the amount of federal debt, public debt, in this country in the next 5 years. Mr. President, we will triple it in 10 years. We are borrowing and spending money around here on a spree that literally is without precedent in American history. And I think it should be of concern to all Americans for the obvious reason. They've got a share of that debt. In fact, according to USA Today, if you just take the amount of debt that has been accumulated since the beginning of this year, with the passage of the stimulus bill, with the new appropriation bill that passed, was 8.3% increase over the previous year, which was twice the rate of inflation, and all the other spending that's going on with the various bailout programs and whatnot, that the average family's share of the debt this year alone is $55,000. Average family share of the federal debt, $55,000 per family in debt accumulated just since the beginning of this calendar year. And so, Mr. President, the amount of borrowing is without precedent. The amount of spending that is being done is without precedent, and all under the guise of this is an emergency, and we've got to react this way. But I think as more of this spending and more of this debt accumulates, the American people become more convinced that the spending isn't solving the problem it was supposed to solve, which was we're going to create jobs, we're going to get the economy growing and expanding again. We haven't seen any of those effects. What we have seen, of course, is more debt, more interest, and a bill that we're going to hand to future generations that is not fair to them, because we shouldn't be penalizing future generations and punishing them because we haven't been able to live within our means. Now, the most recent response to that by the administration was yesterday. They came out and announced that they're going to implement PAYGO. So we're going to have PAYGO regulations or PAYGO policies now in place with respect to the federal budget and the way that we operate here in Congress. And incidentally, even when PAYGO was in effect, it was not very effective, because much of the budget, much of the spending that occurs here in Washington was outside the realm or outside the net of PAYGO. And in fact, if you look at what PAYGO does in terms of its design, it exempts all discretionary spending, would allow all current entitlement programs like Social Security, Medicare, and Medicaid to continue to grow on autopilot. It affects only new entitlements or tax cuts that may be created in the future. PAYGO also allows expiring entitlement programs to be extended without offsets, but not expiring tax cuts. So it's clearly biased in favor of higher spending and higher taxes. And in fact, if it does not apply to discretionary spending, and if in fact it does not in a meaningful way apply to entitlement reform, in other words, it simply it puts sort of a cap on how much entitlements can grow, but it doesn't get at the fundamental issue that these entitlement programs continue to grow unabated. It really is simply one thing. That is a statutory excuse to raise taxes. That's essentially what PAYGO is. Now, the new administration came out with the news bulletin yesterday that this was somehow a bold new step and that they're going to really attack and take on this deficit and this debt that we have. Of course, what they didn't tell you is that the sort of expression that we use in my part of the country is it's like closing the barn door after the horse is already out of the barn. because you've already got all this spending this year that wasn't covered by PAYGO. The stimulus bill, which was $800 billion in new borrowing, was outside of PAYGO. And in fact, if you look at over the past several years now that the Democrats have been in power here in the Congress, they have consistently violated the PAYGO standard about 15 times to the tune of about $882 billion in all this new spending that was done outside of PAYGO. So now it's like all of a sudden coming to the conclusion and realization that now we're going to get serious about deficits. Now we're going to get serious about spending. Now we're going to somehow clamp down on all these new programs that are out there, and somehow, at least rhetorically, subscribing to PAYGO as a concept is going to be the solution and the answer to that. Well, Mr. President, I think we all know better than that. As I mentioned, PAYGO has been routinely sort of ignored in the past, and even if it were to apply, as I mentioned earlier, it really doesn't capture much of the spending that goes on here in Washington. It simply is nothing more than a statutory excuse to raise taxes. Now, having said that, I mentioned before much of the spending that has already occurred here in Washington, and yet the big ticket items are still looming out there on the horizon in the future. And by that I mean health care reform, which is a big priority of the administration. We're starting to see more details, we'll get a little bit of a glimpse of what that might entail. We know for one thing that based upon the statements that have been made by the President and by the Democratic leaders here in the Congress, they want it to include a government plan. Purely and simply. They want a government plan, which means one thing, and that is that the government takes over health care in this country. Because you cannot maintain a private insurance program, you cannot maintain a private sector delivery system, a market-based market-based health care system in this country if you're going to have a government plan. And the government plan is where everybody, according to the studies that have been done, eventually would end up going. They would gravitate there. More and more small businesses either would be forced to pay fines if they didn't have insurance themselves, or offer insurance. And the suggestion is, and I think it's a fair one based upon the analysis that's been done by a lot of the independent outside groups, is that you'll see more and more small businesses giving up their health care coverage and having their employees move over transition into the government plan. The government plan will become the repository for all the employees that are currently covered in employer-provided health care plans in this country. And so the government component of this will continue to grow, and eventually you'll have a system that very much models or is very similar to what we see in other places around the world. Some people talk about Canada, some people talk about Europe, and all these great systems, but the reality is that a lot of the people in those countries come to the United States, and the reason they come here is because we have the highest quality care and because they can get access to it. The one thing that happens when the government runs health care is the government decides what procedures are covered. The government decides what treatments are going to be part of the coverage. The government will decide how soon you can get access to those treatments, and what you find in other countries around the world are long lines, long waits. And that's fairly typical of the countries that I just mentioned. The thing that makes the American system so unique in all the world is its dependence upon, and its foundation is, a market-based system. It's led to incredible innovation, it's led to incredible research and development, new treatments, new therapies, and has provided all kinds of opportunities for people in this country to receive health care. And frankly, as I mentioned before, people from other countries who come here to get their health care. So why we would want to throw out that part of our health care system that is so good and replace it with a government-run system, which frankly, again, the government is going to get in the middle of the decision between the consumer of health care or the patient and their provider, the physician, and make those decisions. And it seems to me that's not a model that we want to emulate here in the United States. We've got, as I said, we have a system that needs reform. We have flaws in the way that our current system works. But the fact of the matter is, it is the very best health care system in the world. And I think it would be a big mistake for us to go down a path that shifts and moves more and more people into a government-run, government-controlled system where the government decides what procedures are going to be covered and how soon you're going to have access to them. I think it does one thing. It obviously would lead to a rationing of health care, and by that I mean simply, again, that the government would have to try and clamp down on costs, limit the access that people have to certain types of therapies, certain types of treatments, and I think you would find less and less choice available in health care in this country. That's what I think a government-run system would give you in the end. And so most of us on this side have, and we've laid out a number of proposals, alternatives to a government-run system. Everybody says, well, come up with a plan of your own. We have a number of them out there. We've got a Coburn-Burr plan that's been introduced. Senator Gregg from New Hampshire has a plan that's been introduced. There's a Bennett-Wyden bill, which is a bipartisan bill that's been introduced out there. But there are a number of alternatives that have been put forward by Republicans. Now, to date, we've only seen little sort of generalities about the Democrat plan. All we simply know is that they're going to insist upon a government-run component to that. And again, it simply is nothing more, nothing less than a government takeover of health care, which is going to lead to all kinds of outcomes that I don't think most people in this country are prepared for, and frankly, if they had the opportunity, would not support. But they have entrusted us with the responsibility to look for ways to make health care more affordable in this country. And there are lots of good suggestions which, as I said before, Republicans are putting forward, but it's going to be very difficult if the bright red line that is put forward by the Democrats here in the Senate and the House of Representatives is a government-run program, a government-run plan, or else. I don't think that's anything that I certainly am not going to subscribe to that sort of a solution for America's health care system, nor do I think it's going to be in the best interests of patients and consumers around this country, or providers for that matter, to do that. So the health care debate is one debate where that issue is still out there, and the reason I raise that is because it ties back into my point earlier that the amount of spending and borrowing and taxing that's going on here is it's if you look back at what's already been done, it's enormous. It's enormous by any comparative standard in American history, but the big ticket items are still out there. Because the health care plan, as we understand it, and again, it's only been conceptual. We've not seen the details emerge from any of the Democrats' ideas. They're starting to roll more of it out. But one thing is clear, it's going to have a huge price tag. We're talking about anywhere from $1 trillion to $1.5 trillion to $2 trillion. And of course, if they're going to adhere to the newly announced PAYGO standard, that means that this new entitlement program has got to be paid for. So where does that $1.5 trillion or $2 trillion come from? Well, obviously, it's going to come from some revenues raised from some part of our economy. That means that a lot of hardworking Americans are going to see their taxes go up to finance this new government takeover of health care, which is going to give them fewer options and get in the way of the patient-doctor relationship and cost them a lot more in the form of higher taxes. And so I think that even though much of the spending that I've already referred to is in our rearview mirror, all that's left is to pay the bill for that. We still have to pay the bill. We're borrowing, which means somebody's going to pay the bill. We're going to hand off the bill to the next generation of Americans, because obviously when you borrow $1 trillion, someday it has to be paid back. In the meantime, when you continue to rack up that kind of borrowing, and when you continue to do all the other things that we're doing in our economy in terms of interventions, whether it's with regard to financial institutions or auto manufacturers, you can kind of go down the list, insurance companies, now that the government actually has an ownership interest in, we are acquiring enormous amounts of exposure and debt for the taxpayers of this country. And the health care plan is going to be another $1.5 trillion or $2 trillion on top of that. When you borrow that amount of money, you do have to pay it back. And when you do pay it back, and the only way, if you've got an economy that you're trying to make the debt and all the interest that's associated with it, which, by the way, I should mention too, the interest on the amount of debt that we're going to rack up in the next 10 years, the interest alone is about $5 trillion. I mean, think about just to pay the finance charge on the debt that we have in this country and the enormous, enormous burden that places on the American taxpayers and the American economy. And what generally happens in a case like that is when you're borrowing that much money, there's a lot more pressure out there, and the people who are buying that debt are at some point going to start demanding a higher interest rate. When interest rates go up, a higher return on their investment, generally inflation follows with it. And so you've got all kinds of economic problems that are created by the level of borrowing that we've already incurred, and we're going to add a new health care entitlement on top of that. It literally is breathtaking, the amount of intervention that we're seeing in the private marketplace today. And I would also add that in addition to, I talked about some of the spending and some of the borrowing that's been done, but in the taxes that are going to be associated with health care, and I could go down a list, there's a 3-page list of the various what we call pay-fors, or ways of raising revenue to help finance health care. But there's also another big tax looming on the horizon, and that's the carbon tax, what we call the national sales tax on energy. But if this climate change bill, which is currently moving through the House of Representatives, reaches the Senate, and if it in fact does pass the Congress this year, that too will entail an incredible amount of taxation, because there is no way that you can attach essentially a cost to carbon in this country per ton and force companies that emit to buy the credits that would be associated with that without them passing it on. They're going to pass it on. And everybody admits that. I mean, the President has admitted that. The leadership on the other side has admitted that. All the utility companies in the country will tell you that. And a carbon tax, a national sales tax on energy, would hit places like where I'm from in the Midwest the hardest, because we are, by and large, proportionally, more dependent upon coal-fired power than are many other areas in the country. And the same thing is true. We've got a sparser population, which means we have a, quote, higher carbon footprint, which means that people in the Midwest, in states like mine, are going to pay way more for energy under any kind of a climate change bill, or what we call a cap and trade bill or cap and tax bill, however you want to refer to it. There is no way of getting around the fact that it is going to cost an enormous amount every single year for families in this country, for businesses in this country, for industrial users, for school districts. I've seen the statistics from school districts in my state, from commercial users, from residential users, about what those costs are going to be, and they really are stunning, Mr. President. And so that's another tax that is still out there. Add that to the health care tax that will come with whatever health care bill is passed through here, and the amount of taxation is going to start to rival the amount of spending and borrowing that's going on here in Washington. But it brings me to my final point, Mr. President, and that is that what I'm really concerned about, and what I'm starting to hear more and more from people in my state of South Dakota, in many cases unsolicited, who come up to me and raise this issue of the amount of government ownership of our private economy. We're seeing, again, unprecedented levels. And if there's one bedrock principle in American history, it is the adherence to the ideals of private enterprise. Now, in recent months, however, the U.S. has substantially deviated from the historical pattern, and the federal government now owns substantial shares of major U.S. corporations. We own, the taxpayers, I mean, you and I and all of us here are now shareholders in a lot of major U.S. corporations. The taxpayers, the federal government, owns 79% of AIG, 75% of General Motors, 10% of Chrysler, 36% of Citibank, 80% of Freddie Mac and Fannie Mae, and it goes on and on and on. And so we've got all this spending, borrowing, taxing. Now, on top of that, increasing amount of government ownership of America's private economy. And if there's one thing that Americans are clear on, it's that the government should not be taking over bigger and bigger shares of the American economy. There was a survey recently by Rasmussen that said 75% of Americans agree that the federal government shouldn't take over the U.S. banking system. And that was a poll done in February. More recently, 60% say that the bailout loans given to GM and Chrysler were a bad idea. That was an April 21st poll. A new poll, May 31st, just recently shows that 67% of Americans are opposed to providing General Motors with $50 billion and giving the government a 70% ownership interest in GM. 56% of voters said it would be better to let GM go out of business. None of us want to see that. but I think none of us also, at least most Americans, do not want to see the government owning more and more of American companies. Now, the federal government is inevitably going to use that ownership stake to push its own agenda. Now, in a moment of extreme candor, former Labor Secretary Robert Reich declared that if the government is an active shareholder, they should, and I quote, push management to take actions that are not necessarily geared toward higher shareholder return, end quote. I mean, think about that statement. They should, the government owns more and more of American businesses, they should push management to take actions that are not necessarily geared toward higher shareholder return. In other words, the government should use its newly acquired power in formerly private companies to further its own agenda. Now, both the political process and the free markets are going to be distorted if that happens. In fact, in the New Republic, Noam Schreiber recently wrote that government ownership invariably politicizes management decisions, which could be a fiasco, end quote. The article notes that a coalition of unions lobbying against providing bailout dollars to Principal Financial Group because of its opposition to card check. So you find more and more of these pressures on now because the government has a bigger and bigger stake of government dictating day-to-day management decisions in American business. That is not a path, I would argue, Mr. President, that we want to go down. And The Economist commented on the government-forced Chrysler bankruptcy, and I quote, "In its haste, it has vilified creditors and ridden roughshod over their legitimate claims over the car makers' assets. At a time when many businesses must raise new borrowing to survive, that is a big mistake. The Treasury has also put a gun to the heads of GM's lenders," end quote. In a recent Bloomberg article, Bradley Keown warns of some of the problems that Citigroup and other banks incur in accepting bailout money and that they may encounter as a result of the partial government ownership. Among them, he cites government pressure for stricter compensation rules, directives to focus on state-approved social objectives instead of increasing earnings, scrutiny of advertising, or being forced to exit risk-taking businesses that are profitable for competitors. So, Mr. President, there's plenty of, thought out there from people who understand the economy and the importance of the private market, its tradition, its contribution to the success of the American economy and the prosperity that we enjoy today, as well as lots of anecdotal and other evidence that when the government gets into these particular situations where it's trying to influence the day-to-day decisions of private business in this country, of management, those who are trying to manage our private businesses in this country, it leads to all kinds of fiascos and disaster. And I would just mention one other point, and that is, according to Bloomberg, after demands from lawmakers, Citigroup consented to support cram-down legislation, even though this policy was opposed by others in the banking industry. Pretty clear, Mr. President, that these types of interventions into the private marketplace, into the free market economy in this country, lead us down a path that is not good for the American taxpayer, not good for the American economy, that stifles innovation and entrepreneurship. In fact, I would argue that it kills the entrepreneurial spirit in this country to have government taking bigger ownership interests, bigger and bigger ownership stakes in the American economy, and further dictating the decisions, the day-to-day decisions which American businesses make that are designed to grow their companies, to get a better return for their shareholders, to become more profitable, to make America more prosperous, to raise our standard of living, to deliver more benefits to their employees, all these things that have driven this economy and made it the envy of the world. And I just don't think that we want to go down a path or stay down a path that gets us deeper and deeper in to ownership of the private economy. So, Mr. President, I'm going to be in the next day here introducing a piece of legislation which we will be introducing and filing tomorrow, which addresses this issue and which provides an exit strategy for the government, for the federal government, for the taxpayers to begin to get out of all these ownership interests that they have in the American economy. And I'll have the opportunity here on the floor to talk more about that at a later time. But I wanted to just this afternoon, as we begin the debate, and which has sort of captured this city and the Congress and the administration, and I think very soon will engage the American public over health care reform and the new taxes, the trillions in dollars of new revenues that are going to be necessary to finance the proposal that the new administration has for health care reform, and how that takes us even further down a path of government intervention, level of nationalization of our private economy, in this case health care, and that pattern that just seems to be continuing here, which I think more and more Americans are reacting to. More and more Americans, I believe, are going to be engaged, and I think that members of Congress on both sides are going to be hearing from their constituents about what they perceive to be a real threat to the long-term viability, the long-term prosperity, and the long-term protection of the taxpayers' interest. And so I hope they will become more engaged, and I certainly hope that we'll be able to defeat proposals that come before the United States Senate that call for greater government ownership, greater governmental invention, greater expansion of governmental powers in Washington that will limit the choices of Americans, limit their access to health care opportunities, health care therapies, health care treatments that all too often are lost, I believe, in a system where the government rations care. Mr. President, I yield the floor, yield back the balance of my time, and I would suggest the absence of a